the most important pregnancy scan, there are high risks of baby being born with congenital abnormalities. Hello everyone, I am Dr. Shrikant Bhodke, a consultant fetal medicine specialist, and today I will be talking about the most important pregnancy scan, that is knuckle scan or NT scan. Pregnancy. Pregnancy is the most wonderful phenomenon to happen to any woman. The joy of a woman knows no bound whenever we convey this news to a woman that she is pregnant. However, in this excitement, it is important to note that at the same time, pregnancy is a very delicate situation which warrants optimum medical care and management. In today's hectic and competitive world, with increasing targets to achieve, unhealthy lifestyle, environmental pollution, and an increasing maternal age, there are high risks of baby being born with congenital abnormalities. This can spoil the joy of to-be parents and their parenthood. Hence, all efforts should be made to screen the baby during pregnancy to rule out congenital abnormalities in the baby. In this series of providing valuable information on important pregnancy scans which a pregnant woman should not miss at any cost, we will be first talking today on NT scan, that is knuckle scan. So what is a knuckle scan or NT scan? A knuckle scan is the most important ultrasound examination performed between 11 to 13 weeks of pregnancy. NT scan is an ultrasound test that measures the amount of fluid between your baby's neck in the first trimester of pregnancy between 11 to 13 weeks. Measuring the amount of fluid behind your baby's neck helps us determine the chances of your baby having a chromosomal or genetic abnormalities. Normally, a small amount of fluid will always be present behind your baby's neck. However, more fluid in this area would indicate that your baby may be having an underlying chromosomal abnormality like a Down syndrome, Edwards syndrome, or Patau syndrome, which are form of trisomies or chromosomal abnormalities. A higher NT measurement, that is increased amount of fluid behind your baby's neck, may also indicate the presence of underlying congenital heart abnormalities. The result of NT scan can determine if your baby is likely or unlikely to have these conditions. At the same time, NT scan can also see some other basic structural abnormalities in your unborn baby. Other abnormalities, if identified at the time of NT scan, may further increase the risk of genetic or structural conditions. So the next question comes automatically. When is a knuckle translucency scan or NT scan done? NT scan is done only between 11 to 13.6 weeks of gestation. Not before that, nor after that. But the question is, why only between 11 to 13.6 weeks of gestation? It is because before 11 weeks of gestation, there is negligible or no fluid which is present behind your baby's neck. And after 14 weeks, the fluid gets automatically absorbed by the baby's body. So it will be practically impossible to measure NT, that is knuckle translucency, before 11 weeks or after 13.6 weeks. So remember, the most important point is NT scan is done only between 11 to 13.6 weeks, which roughly corresponds to the baby length of 45 to 84 mm. Any NT scan done either before 11 weeks or after 13.6 weeks will not be accurate. So how accurate are the NT scan test results? Knuckle scan test alone can detect nearly 70% of trisomies or chromosomal abnormalities. When knuckle scan test, that is NT scan, is combined with a blood test called dual marker test, the accuracy of the test goes right up to 95 to 99%. Who should undergo NT scan test? All pregnant women should undergo NT scan test because it is the most important scan which has to be done between 11 to 13.6 weeks of gestation. Now, for example, what happens when you get an abnormal knuckle translucency scan report? First thing, do not panic. Remember one thing. Abnormal NT scan report does not always mean that your baby is abnormal. If you indeed get an abnormal NT scan report, your healthcare provider may advise you further tests like chorionic villus sampling or amniocentesis to confirm whether the baby is actually having an underlying chromosomal abnormality or not. They may also refer you to a genetic counselor to better understand the condition and the risk associated with them. In a nutshell, NT scan or knuckle scan is the most important scan which a pregnant woman should not miss at any cost and should always be done between 11 to 13.6 weeks of gestation. Wishing all the to-be mothers and fathers a very happy and joyous pregnancy and parenting. Thank you.